If food feels like it stops in your chest, achalasia may be the reason your swallowing has changed. Achalasia is a disorder where the food pipe cannot push food down and the valve into the stomach fails to open. Common symptoms include difficulty swallowing, regurgitation of undigested food, chest discomfort, and unexplained weight loss over months or years. Doctors confirm achalasia with a barium swallow showing a bird's beak shape, endoscopy, and manometry that measures esophageal pressures. A Heller myotomy is surgery that carefully cuts the tight muscle of the lower valve so food can pass into the stomach. The operation is done through 5 or 6 small keyhole incisions on the upper abdomen under general anesthesia, typically lasting 1 to 2 hours. After cutting the muscle, surgeons wrap part of the stomach around the lower esophagus. This partial wrap helps prevent acid reflux afterwards. Alternatives include POEM, an incisionless endoscopic myotomy, pneumatic dilation with a balloon, and botulinum toxin injections for those unfit for surgery. Most patients stay in hospital 1 to 3 days. A contrast swallow test checks for leaks before starting sips of water. Diet progresses from clear liquids to full liquids to soft foods over about 4 weeks, then a gradual return to regular meals. Main risks include a small tear in the esophageal lining during surgery, bleeding, and long-term acid reflux that may need medication. Long-term, most patients eat comfortably again by chewing well, sitting upright at meals, and having periodic follow-up endoscopy. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.